How you doing? My name's Gianni. I'm your student physical therapist today. So what we're doing is we're just going to look at just how the lower part of your back is moving, see if it reproduces any of that pain you've been feeling. And we'll look at your hips as well, a couple tests. But for the first test, I'm just going to look at how your lower part of your spine is moving. Is it okay if I lift up your shirt? Okay, thank you. So what I'm going to be doing here is I'm just going to be assessing your spine. I'm going to be pushing down a little bit. You just let me know if there's any pain with any of these, okay?
Okay.
So I'm palpating here. I got L5 right here. So I got it here, and then I'm just going to assess. Looks good there. Got L4. Looks good there, and then I'm going to go up to L3. All three of those look good. So let's say there was a case where they're a little restricted or hypomobile, but she didn't have any pain with it. So what we could do to, try to get it to where it's the right mobility is we could do an L3 or grade 4, grade 3 mobilization. And then what I would do is, let's say I did the grade 3 is fine, so I want to get the end range of that grade 4. So let's say at L5. So what we're going to do is we're going all the way to that end range, and then with a slight oscillation at the bottom there. Short range. Any pain with any of these?
No.
Same thing with 4, so I'm going to go all the way down, and then good, and then L3 here, same thing, all the way down, that end range. There, good. Okay, good. So we looked at kind of the accessory motion, so something you can't do on your own. Now we're going to look at something where your knee, your leg is going to produce some of that movement in the spine. So what I'm going to have you do is I'm going to have you face me. And same thing, I'm just going to kind of assess if there's any pain with any of this, you just let me know. Okay, so what I'm going to be doing is palpating. So we got L5, L4, L3, L2. So I'm going to go between 2 and 3, and 3 and 4. And I'm just going to lift this leg up here, get her in a neutral position. So kind of like right in here. And then we're just going boom. Okay, I can feel 2 and 3 going. So now I'm going to go to down a little bit. Let's look for 3 and 4. Boom, right there. Good. And then the last one between 4 and 5. Good. Feel it right there. Good. Any pain with any of that?
No.
Segments seem to be moving properly. Everything was coming together at the same time. Fluidity in the right part of the movement. So with that, assessment looks good there. Okay, so for this next test, we're going to it's called a prone instability test. So what I'm doing is just testing what some of the pain that you have going on here to see if it has anything to do with maybe us having to strengthen some of your core, like some of your muscle stabilizers in here. So I'm just going to see if doing a certain motion reproduces that pain or decreases that pain, okay?
Okay.
So I'm just going to go here and then feel for. L4 right now, and then so if that reproduces her pain, what I would do next is I would say, okay, we're gonna hold on to the table, and I'm just gonna have you kind of kick your legs up and try to hold your legs up in the air, okay?
At the same time.
Yes. So kick your legs up and hold your legs in the air. Good. And I'm just gonna go right back to L4. I'm just gonna see, does that make the pain better or worse? Same?
Same.
Okay, so with that, that's a negative test. So a positive test would be if that decreased her pain, that means those muscles are engaged there. And what we need to do is work on those core stabilizers and the stabilizers in the lower back to help with that pain decretion, and then hopefully when we're doing that over time, that pain decreases automatically. So the next test we're going to do is we're going to do a slump test. So what I want you to do is I want you to sit up over here. So sit up here. And then what we're doing here is we're testing, so this is for like the radiculopathy, so you have some of that pain that kind of shoots down the leg when you're doing any sort of movement that aggravates that area of your low back. So this test is just going to see if that pain reproduces. So if it was a positive test, when we do these certain combination of motions, you would feel that pain, okay? So what I want you to do is first I want you to just try to bend at your low back and your mid back, and just try to bend forward. And then I want you to tuck your chin into your chest and then kick out your left leg. Okay, so if there's a positive test, she would reproduce those symptoms. If not, you can kind of point the toes up, and then I could also apply some overpressure here and see if that reproduces the symptoms. And then, like I said, a positive test would be reproduction of symptoms, and we can also do it on the other side if it was radiating down the right side. So the last test we're going to do is I'm going to have you lay on your side facing this way. So this is for sacral iliac joint. I'm going to scoot just a little bit over here. So this is to test the sacral iliac joint. So I'm just going to test your hip a little bit, okay? So with this one, there's 4 different tests we can do. We're just going to do 2 today. But with this can also maybe contribute to your low back pain if there's something going on in the hip. So when I'm doing these, I'm going to press down on the side of your hip and just see if that reproduces any of the pain that's maybe going on in that lower back, okay? Okay. So I find kind of right here on the sacra, and then what I'm doing from here is I'm just pressing down and medial. So down and medial. And I can do this for about 30 seconds. Anything there?
No.
No? Okay. And I could also flip around and do the other side. And then let's say that was positive. There could be some something to do with the sacroiliac joint down the road if other tests are positive. So let's do the other test. So I'm going to have you lay on your back. And then leg straight. I'm going to cross your arms. It's okay if I put my hands here. So what I'm going to do is this is going to be a distraction test. So I'm just going to have my hands kind of right in this area here. So I'm on the medial border, the ASIS, and then just pressing down. Posterior lateral, posterior lateral. Anything there?
No.
No? Okay, good. So with those tests, there's some research being done. If 2 of the 4 tests are positive, there's 2 other tests in that cluster that could be a sign that it is the low back pain could be coming from that sacroiliac joint. Overall, thank you very much.
Thank you.